Lords, I'm rising to speak on behalf of Schedule 17 generally and to support Amendment 424 in the name of Baroness Findlay. And in that, I'd like to declare my wife's interest as a board director of Tesco and of Diageo. But I'd really like to focus my comments on the amendments supported by my noble friends Lord Vasey and Lord Moylan, and in doing so seek to address all the amendments that they've put forward that seek to extend the implementation period for the new restrictions, to introduce brand advertising exemptions, to bring in effectiveness reviews, sunset clauses, and all the other clauses that seek to water down the really important measures in the bill on junk food advertising. Now, in doing so, I recognise already that the noble Baroness Boycott has gone through some of these amendments in detail. I don't want to go through that again. But I am aware that noble Lord Vasey and others have brushed off the government's obesity strategy as wrong-headed and doomed. And the noble Lord Clement Jones has shared his view that the measures in the bill are disproportionate. So I would just like to reflect for a moment on what we are trying to do here. We have, as a country, got into a situation where, by every measure, we are seriously overweight. The worst affected are the children, as we have heard in statistics in this debate many times in this chamber. 2 out of 5 children are overweight. And the worst affected of the children are the poorest of the children, often 2 times more likely to be overweight. So when we think about the environment that our children are being brought up in, and this question of environment, I think, is absolutely critical. What are our values as a nation if we knowingly create an environment that encourages children to develop addictions to food that we know will hurt them, will adversely affect their moods, will hold back their learning, will reduce their self-worth, and will damage their health for years to come? My Lord, we've seen through this pandemic that it is time to lean into this ongoing national disaster. The measures in this bill are necessary because they are an essential condition for an overall change in the direction of travel for childhood obesity prevalence. The challenge is going from an increase in the weight of our children of around 1% per year to a decrease of 4.2% per year. That is an astonishing mission. It's a massive challenge. No country has ever undertaken such a thing. But I am not convinced that we can just hope that our primary schools will do all the heavy lifting and achieve that. Somehow, as a country, we have to change the way in which we run our lives. And that will require a change in the environment in which our children learn about food, engage with food, and buy food. And that includes the media that they consume. If we fail, for every year that this is not achieved, the rate of change needed in future years grows. And thousands more children are exposed to the physical and mental impacts of obesity. The noble Lord Krebs talked very eloquently about 20 years ago, the Hastings report had this research nailed. There is now a sense of urgency, and that's why these measures are needed. That's why we cannot seek to extend the implementation periods for new restrictions that will just drag them out indefinitely and undermines the seriousness of the programme. That's why we can't give brand advertising an exemption that clearly leaves the door wide open for the same old advertising in different ways. That's why we shouldn't commit to effectiveness reviews that will become a rearguard action to unpick these regulations, or commit to sunset clauses that will just give industry false hope that somehow the government will just give up on these measures, or the problem is just going to somehow go away. My Lord, to reach the 2030 target, it's absolutely crucial that the government continues with these plans to restrict junk food advertising on TV and, as the noble Lord quite rightly said, online, and that it doesn't waste any more time. It's crucial that we introduce fiscal measures to speed up reformulation at the same time, making healthy eating more accessible to everyone. It's absolutely clear from our data that any delay in actual implementation of the proposals to address childhood obesity will have a significant impact on the ability of the government to achieve its ambition. More children will grow ill, more will have shorter lives. Now, I do hear very loudly and clearly the concerns of the noble Lords, Lord Vasey and Lord Moylan, and to the Lord Clement Jones. I hear their concerns about the science, the research, the public health, epidemiology that underpins these measures. I don't agree with their scepticism, but I do hear their concerns. So let me just pick off a couple of those. Noble Lord Vasey, my noble friend, has expressed scepticism about the effectiveness of these measures. And he is right. These advertising restrictions will not work on their own. Obesity is a complex issue, and there's no one single policy that can solve it on its own. But small steps do matter. It can take as little as 46 extra calories a day for children to gain excess weight, and seeing off 1 minute of HFSS adverts leads to children eating an extra 14 calories a day on average. And as I said earlier, this question of environment is absolutely critical. I accept that we need population-level structural policies to address the social and economic drivers of obesity in order to address the growing inequalities between the most and the least deprived children. And that's why the Levelling Up white paper earlier this week that tackles housing, education, deprivation, and many, many aspects of British life was so critical to this debate and forms the context in which we should be discussing these measures. And it's why my noble friends should not feel that the broadcast and food industries are being in some way uniquely scapegoated. This is a national programme that will touch on many, many lives. My noble friends are right to express concerns about the fortune of the broadcast and internet industries, two jewels in Britain's creative industries and employers that drive local economies. So let me reassure my noble friends that I once worked in the media industry, and I haven't forgotten about the intense competition for advertising and the existential battle with big tech. But my noble friend Lord Vasey spoke as if many of these companies would find that all communication by these companies on all their products to all their target markets would somehow be terminated forthwith, and the British public service broadcast industry would be thrown into destitution. That's just not quite right. Noble Lords should know that Cancer UK found that ITV, Channel 4, Channel 5 and Sky One derive a small proportion, just 8% of their total ad revenue from adverts for HFSS foods. Now, it is true that almost two-thirds of HFSS product adverts aired between 6 and 9 fall within the categories that UXA have identified as being the highest contributors of sugar and calories in people's diets, a fact that I found quite alarming. But under a 9 p.m. watershed, broadcasters would only have lost 5% of their total advertising revenue if all HFSS adverts were removed completely without anything in their place. But in fact, noble lords should know that over 3/4, 79% of potential revenue loss from removing HFS adverts could be mitigated against by companies advertising their existing non-HFSS products instead of promoting their HFSS ones. Healthier foods can still be advertising. So, my lords, by way of conclusion, it's just not right to call these measures appalling and crude or ridiculous and blunt. To change the environment in which our children make decisions about food is absolutely critical for this national mission. And to contribute to a campaign to improve the health of the children is a commendable aspiration for these government measures.
Perhaps channeling Baroness Deach from this morning, I should start by congratulating the government on including within the bill these measures to tackle childhood obesity. The fact is, as we've heard, that with 1 in 4 children clinically obese, not just overweight, but clinically obese, we are storing up huge problems for the future, because we know that what starts in childhood continues into adulthood. So in that sense, diet is destiny, and unfortunately,